at the SOHO meeting, I gave a Meet the Professor session on the combination of BTK and BCL-2 inhibitors in patients with CLL. So currently, BCL-2 inhibitor, Venetoclax, as well as a BTK inhibitor, Ibrutinib and Acalabrutinib are approved for patients with CLL. And one of the emerging themes of therapy for patients is combination of these two drug agents together. So that was the topic assigned to me. So there have been several clinical trials, some by our group and many other trials going elsewhere in the country as well as internationally, where patients are being combined. They're given Venetoclax, which is a BCL-2 inhibitor, in combination with a BTK inhibitor, which could be Ibrutinib or Acalabrutinib, and now Zanubrutinib, that's another BTK inhibitor, and with and without a CD20 antibody, which most of the trials are pursuing with obinutuzumab. And so the data we have reported last year showed that if you combine Ibrutinib plus Venetoclax, two oral drugs together for patients with CLL, for patients who need therapy for their CLL and who have no prior therapy for their CLL, for those patients, around 70 to 75% of the patients will achieve MRD negativity, so no reduction of minimal residual disease in the bone marrow with a sensitivity of 10 to the power minus 4. This was seen in approximately 70 to 75% of the patients in the bone marrow. And similar results have now been reported by other studies, including the large CAPTIVATE study. So I think it appears to be that this is a very effective approach for patients with CLL. I think it remains to be seen how this approach would fare compared to a more traditional approach in a way, or an approved approach in a way, which will be single agent BTK inhibitor therapy or the combination of Venetoclax plus obinutuzumab, which is based on the CLL14 study. So those studies are still ongoing. I think hopefully we'll know in the next 1 to 2 years more about these studies. But so far it appears that yes, outside of a clinical, in a clinical trial setting, the combination of Ibrutinib plus Venetoclax, a BCL2 and a BTK inhibitor seems to be quite synergistic and active.